Hey guys, this is Thomas over here, nursemoneytalk.com, and in this video, I'm going to actually answer a question that I got from one of you guys, and it is from Time Is at Hand, and it reads, "Hello, I was hired to work in an assisted living in California. They want me to train for like a few days, and I had to push for that. They wanted to do 2 days. I have never worked in a facility, but in home care one-to-one with children. I am an LVN. I didn't return after the first day. She said next week I will be working by myself. I know I am not ready for that. She said they can't train me for weeks. The facility has 61 beds. What do you propose?" Before I get into that, if you're not already subscribed, I want to go ahead and invite you to hit that subscribe button. On this channel, I talk about all things related to nurses, and if you have a question that you would like me to answer, you can always put the question in any of the YouTube comments, but the best way to increase the likelihood that I'm going to see it and potentially answer it on either on the YouTube channel or on the blog is by going to nursemoneytalk.com/ask, and then it'll give you two options where you can either record your question, or you can, if you go lower, it'll give you an option where you can actually type out your question. So either one will work. So let's go ahead and get into this. So the first thing I'm going to do is I'm actually going to summarize what the question was. So based on the question, it is a nurse that was hired to work in an assisted living in Cali. They came from home health where they were working one-to-one with children, and they've had some kind of like issues with the facility in terms of what they felt was not getting adequate training. They've had 1 day of orientation as of now, and they feel like they are not ready. Generally, whenever I answer questions like this, especially given the information that I have at hand, there's a lot of kind of things that I kind of have to fill in, right? So, for example, like I'm just kind of wondering in terms of the experience that the nurse might have had. Like in the question, it says that they are an LPN or LVN. But how long have they been a nurse? What are the other kind of like potential experiences they might have had that they potentially might have put in a resume that maybe is driving kind of like where like the initial thought of whoever this hiring manager is. So that's just kind of like the things that I'm just kind of wondering as I'm trying to make sure I'm like kind of getting a full picture. But in and of itself, given what I know about just kind of like the nursing homes and assisted livings and just kind of like nurse managers and hiring managers whenever they hire nurses, I just want to go ahead and just make sure that I validate kind of like your feelings and your thoughts in this, because first and foremost, if you feel like you're not ready, then there's a reason why you feel like you're not ready, right? We know that this isn't a situation where it's a brand new nurse that just feels like they're coming off orientation and they're not ready. That's a completely different scenario where this is a nurse who has experience and they feel like they haven't been adequately prepared for their role, right? And in general, given what you've already told us, 1 day is not a lot of time. It's really not. And like I've seen situations where like even agency nurses will get more orientation time than just a couple of days you were given. And even the agency nurses that I have seen where they only get a handful of days or whatever, those are typically with the requirement that those agency nurses that they're kind of like experienced in that area, right? So it's not like I just kind of let me just kind of take that back to like kind of like the in-hospital area, because I think that will make a better picture that most of you guys will understand. Is like that's not like you have somebody who's only worked med surge, and now they're being hired with 1 day, 2 days of orientation to then go work the ICU. Or even if the reverse, they've only worked ICU and now they have like 1 or 2 days of orientation to then go work the med surge. They don't have experience in that specific area. And so that's going to make it very challenging because, given your background, there's a huge difference, in my opinion, having worked with pediatrics, adults, geriatrics, and whatnot. There's a huge difference between working with kids and then working with adults. And on top of that, there's also a pretty sizable difference between working with a patient one-on-one versus working with a patient where it's like I think in this situation you said it was 64, so 1 to 64, 1 to many. There's differences there, like the routine is going to be very different. This is besides the fact that somebody might say, well, there could be differences in acuity, and even besides acuity, there's just a big difference between like all of those things, the patient population and the number of patients. And so I say all of this to get back to this point that I think if I was in your situation, and I think if many people were in your situations, that there would be a certain level of concern. And so the options that I would probably look at doing would be calling around and seeing what options are available, right? I'm not quite sure what the kind of like the market is for nurses in your specific area. I know, people will say like California is a big place. The demand for nurses or anything is going to fluctuate based on whatever the area you're at. So I would probably look at it and see, what are the kind of like the demands there? How quickly can you get another job? And if you get a better offer, honestly, you could then just take that job without even just giving notice, and just take that job, quit that one, and then just kind of go over there. Or you can use that opportunity to then just kind of leverage that to tell the other job, like, hey, I don't feel like I am adequately ready for this job. I need more training, or I'm honestly not going to be able to do this job. Just kind of like have that conversation with them, and then just kind of figure out what they say at that point. Now, I think it's important to note that if you are going to have kind of like that conversation with them, that whatever, I don't know if ultimatum would be the best way to kind of phrase it, but whatever option you give them, you need to be ready to carry out that option, right? Like I don't want to use the term threat, but that whatever that option is. So if you say like, hey, like if I don't get more time, I'm going to leave, then you need to be prepared to leave. Otherwise, I think that would potentially create more problems for you in the long run if they don't kind of give a little bit and you end up not leaving. And also, like, if you're going to have that conversation and going to, kind of give them those options, if you will, probably have an idea of how long you would actually want that orientation to last. Maybe like kind of like what you're trying to accomplish, maybe like what your goals would be. And so just kind of like have that in mind. Something else just to kind of keep in mind in terms of as you're looking around and kind of gauging what your options are or are not, I think the amount of savings that you have will kind of play a factor, because, what if you end up having to leave, right, without having a job secured? Then you might be in a situation where you don't have a job for a little bit, because even in a high in demand play like area where they really need nurses, if you are in a place like that, like there's still most likely going to be a little bit of time between you quitting that job today and then you being able to go ahead and getting another job. So those are just kind of like some things that you're gonna have to keep in mind. And so normally for anybody who has watched any of my previous videos, I am generally not a huge fan of kind of like just up and quitting on employers, not without giving like a formal 2 week notice and all that other stuff. Not because necessarily like I care that much about employers per se, as it is that I just recognize that there is, this power discrepancy and power dynamic between an employee and and an employer, because ultimately we know that employers like will fire people, like left and right. Like how many, even just looking at the latest news, how many layoffs have we heard? Many of whom aren't getting like severance pay, especially like if you're in healthcare, you're probably not going to get severance pay for just being laid off or fired. And so it's just recognizing that power dynamic there, or discrepancy, if you will. But the big difference is that if you note, generally when I say that, I always throw in a caveat that in extreme circumstances or in certain situations, and one of the big situations is that if you think that you're being put in a very bad situation. And so I would count being required to do a job with poor training or inadequate training as being put in a bad situation. Because ultimately, if I tell you to put in a 2 week notice so that you can prevent from being like non-rehirable, if you will, since that is ultimately kind of like why I say that, so that you always have an option there. I think it's important to note in this situation, the reason why you're so concerned is because like potentially a poor patient outcome, which nobody's wishing that, but that is kind of like the thing, the conversation we kind of have to have though, is like ultimately a poor patient outcome could ultimately lead to a loss of license and then loss of ability to take care of yourself and provide for your family. So ultimately, those are the things I would look at. Start kind of looking at what your options are out there as you're having conversations with them, and looking at kind of like maybe they would give a little bit in terms of letting you have some more training. Or if they don't, then I would probably just have to quit and then just kind of scramble to see if I could find, take whatever job's available, just so you're not out of an income for too long. One last thing that I will just throw out there, and it is, as I read this and I just kind of like think back to all the nurses that I have talked to, either the ones that have sent me a message or just over the years, or the employers or whatnot that I've worked for, and just kind of like everything that I've seen, right? And that's like, if you have a really bad situation that happens very early on, it doesn't bode well for your long-term tenure there, either with that specific employer or maybe it's that specific manager. This could be a sign that these are just not good employers to work for, or this is not a good manager to work under. So I would probably end up like, even if they give you more orientation, I probably would honestly still be looking to potentially jump ship if something really, like something better comes along, just because of how to start off. Or even if, like, let's say this is a one-off thing, right? Like, this, for whatever reason, maybe they were just like super short-handed, and this is not typically how they handle things, right? Even then, I think there's a risk that it would develop such a very sour taste in your mouth, if you will, that you're just not going to be happy with either this manager or this employer moving forward. So those are, honestly, it's just some things to think about. And so just remember, nobody cares more about your license or your well-being the way you do, right? So the employer will always be looking out for what's in their best interest. And so you as the nurse, you as the worker, you honestly also need to be looking out for what's in your best interest and what will allow you to continue providing for yourself and your family moving forward.